That would be great. I appreciate the question, and it's a thoughtful question. The answer is that if something is risky somewhere else, there's no reason to believe that risk doesn't apply here. Our level of illness is lower here. All that means is there's less likelihood that this would happen. It doesn't mean that the risk is any different with the activity. If we want to stay at stage 3, if you want to stay in a situation where we can continue to have, team sports and class fitness activities, we need to take action to prevent the spread. So we're not going to wait until we have, an outbreak with hundreds of cases here in order to take these sorts of actions.
Dr. Summers, I think your microphone is on mute.
Mr. Flaherty, thank you. Rookie mistake. The next question is from Tommy. Open gym models like Good Life continue to have the 50-person per room capacity, while group training facilities have now been reduced to 10 per room regardless of the room size. How is an environment where a trained staff member is in charge of controlling the spacing and safety procedures of the member less safe than the environment where 50 gym members have no instructor or guiding authority during their workout? There's more to that question. I just want to answer that first part. So to be clear, using Good Life as an example, the way that the directive is applied is that the spin classes that are happening in Good Life must adhere to the limits that are currently being outlined. So the Good Life experience, and not to pick on Good Life, but the example that has been provided, the 50-person capacity is for the facility. The 12-person limit is for the spin class or other group activity that would be happening within the Good Life in one of their training rooms. I hope that provides some clarity to that question. The remainder of that question provides some assumption that these two facilities have the same amount of space. Again, just trying to link the fact that there might be some inequality between those two facilities. But again, really, it is about the consistency that for that class itself, the limitation is being provided. I would say, for example, if there's a spin operation within our region that had multiple rooms in which they were providing classes, they could provide those classes in multiple rooms. They'd have to make sure they're controlling entry and exit to make sure that people are keeping distances. However, the key thing is that the room in which the class is happening is maxed out at 12 plus the instructor.
Thanks, Alex. The next question is around instructors wearing face shields instead of face masks. Unfortunately, face shields do not replace face masks. Face shields can add to protection against splatter into the eyes, but they don't adequately protect against people exhaling droplets into the air. The droplets can just travel with the air around the face shield. So face masks are much, much more effective at catching the droplets. When you're breathing through a face mask that adheres right to your face, that mask will catch droplets, whereas the face shield only catches the largest droplets. And the little ones that are more likely to travel far and to get into the lungs and make somebody sick are essentially unaffected by a face shield.
Next question is from Sandy. I'm a client of a small home yoga studio with class sizes already reduced to 7. The owner does not believe she can reduce further and still make an adequate earning. We've been respecting all the guidelines without issue. So for Sandy, it sounds as though this home yoga studio would be in compliance with the order as currently outlined. So this small home yoga studio, let's walk through what it would be. Max of 12 people, you're at 7, that's in compliance. The instructor now needs to be masked in order to ensure that transmission is not happening. Spacing needs to be maximized as per the order, but that operation could continue.
Thanks, Alex. The next question from Phil. Schools have over 30 kids in a class. Sorry. Yeah, school buses are full. What's the difference for kids to restrict them at 10 for sports? Keeping our kids healthy is important. This is very confusing. Yeah, I think I addressed that partly during the presentation, but just to reiterate, the difference is A, masking, and B, heavy breathing. Kids in class and on school buses are wearing masks universally. That's required of all kids. And they're not generally breathing heavily in class or on the bus. You know, if they're involved in physical activity, it's usually outdoors, which is much lower risk. And so you've essentially got a totally different scenario, two additional levels of protection or differences in risk anyways. Wearing a mask in those settings and a lack of heavy aerobic and intense activity.
Next question is for you, Chris, but I think I can take this one too. This is from Andy. The Ontario positivity rate is 2.21% over the last week. Ontario is 4.4% and Ottawa is 2.4%. Toronto states their goal is less than 3% on their website. London's rate over the last week is 0.3%. Our numbers are relatively stable. Londoners have been really great and the hockey community has gone above and beyond. My question, what are your outcome metrics in terms of rolling back things and opening things up? How long does our percent positivity rate need to be? We have had one death in the last week of a 91-year-old with multiple medical issues. At this time, these measures appear unfair. Thanks, Andy, for the question. I think critical to note is that because of the current incidence rates, which is what we look at predominantly, in addition to the number of cases which are unlinked and the number of outbreaks that are happening in a variety of settings, we monitor those metrics closely. And in areas like Toronto and Ottawa, you are quite right, they are higher. And that is why they have more restrictions, which includes the closing and complete shutdown of many of the things that we currently still have operating and will continue to operate under this new order. The metrics that we will monitor are ongoing declines in the incident rate and a lack of transmission in some of the settings, which we are hoping we can avoid. But when we look even an hour up the street towards Hamilton, we see massive, disastrous outbreaks associated with fitness. And in Ottawa, as much as their rate is higher than us, they are seeing profound outbreaks amongst physical activity such as hockey. So you note in there that Londoners have done really great and hockey community has gone above and beyond, and that is undoubtedly true. The key thing here is that these restrictions and these orders are not indictment of what has been done to date. It is reflective of the increasing prevalence or the increasing amount of COVID in the community. As COVID has gone up, so too must the restrictions, and that's what's being reflective here. And further to Chris's point, we need to act ahead of time so that we are not in a position like Toronto and Ottawa, where A, we are seeing more illness and more death, and B, of course, that we're having to shut down things which we do not want to shut down.
Thanks, Alex. Next question from Peter E., London junior parent. Chris, is there any serious hospitalizations related to youth sports? Well, yes. The answer is yes, usually not directly. What we've seen in every jurisdiction around the world where wave 2 has struck is it rips through young people, ages and 20s and 30s, give or take a decade or so. And that's where the risk-taking behavior tends to be highest and where the first part of the wave 2 spread happens. And then, inevitably, the illness spreads from those populations into folks that are more advanced in age and at much higher risk. So what we're trying to do is stop the spread or at least limit it in the younger populations and the populations that are playing sports so that it doesn't transmit into those higher paid populations where it will cause serious effects. And, in this part of wave 2, we have seen fairly good results here at London and Middlesex. And until recently, we would have said that the firewall is holding. We had active spread in healthy young people, but no deaths and very few cases in the elderly. That is now changing. Over the last week, we've got 2 deaths, including a long-term care resident who had not left their long-term care. So we know as the burden of illness increases in the general population, it just is impossible to sustain that firewall to the older population and the higher risk groups. And that's where it's really, all of us can play a role in reducing the deaths by preventing spread in this population.
Next question's from Alex with Brasa Bowen, Brazilian Jiu-Jitsu. The question, we are approved and regulated by a PSO. That's a provincial sporting organization, I believe. We have a return to sports plan and follow it on every level. How does this affect our private programs? The fact that you're regulated by a PSO does not mean that the Ministry of Health, the provincial government, or this order do not apply. So this order still applies to you regardless of your professional sports organization. And so it's important that you review this as relevant to your environment.
Thank you, Alex. Ed Hughes, the Little Gym of London. We teach parent-child classes. We need a parent and child to be considered at one unit. As one unit, I think implied. They live together all the time. Parents in these classes don't exert themselves. They just provide support for their child. I don't see any reason why we can't have 12 parents and their kids in a 2750 square foot facility. Yeah, I mean, I guess the easy question back to you, Ed, is can you separate, can you separate those into two groups and keep a 3-meter buffer between them? If you can, then you're entirely in compliance with this order. If you can't, I think we probably should have a follow-up conversation because I take your point, and also there are going to be risks to that situation.
Next question from Natalia. Hi there. I'm wondering why flotation therapy, which has been very therapeutic to my family and I, are being shut down. I think through this pandemic, sensory deprivation is really helping people. Thanks for the question on this one. We'll need to verify exactly how flotation therapy fits within this current order. So thank you for that question.
Yeah, I think if you're meaning flotation tanks that have people separated in different rooms, I don't see that being affected here. But Alex, do you want to take a look at that? Just how the order is written? Yeah, and to be clear, Natalia, like Chris, our objective was if they're separate spaces like these flotation float tanks, those would not be shut down within this order. So that wasn't the intention, was to shut down that order. I don't think this language speaks particularly to that, but we'll review that to make sure that that's clear. When we are talking about steam rooms, sauna, whirlpools, bathhouses, we're again focusing on areas where people gather. So again, I'm going to use Good Life as an example, and my apologies if Good Life is out there, is that the change rooms in a Good Life remain open, as do the showers, but the sauna is closed. And that is again, areas where people are going to be in closed quarters, where there's going to be ways in which droplets are being circulated and more readiness. So again, it's not quite what we are trying to capture with this type of flotation therapy situation. Yeah, thanks. I completely agree, Alex, having reread the question and the order. Flotation therapies in separate tanks is fine. Pauline McCallum, president of London Juniors Knights Minor Hockey, with 25 per ice pad, do they have to be split in half of one end of the ice and half of the other, or split in the blue line? How would participation be more acceptable with items like the CCM game on masks? Players, coaches, officials to wear them at all time on the ice. So on the first question, 25 per pad. So there's two situations. One, you're in practice version. If you're in a practice, you can have, yes, 12 at one end, 12 at the other, plus instructors. If you're in a situation where you're in a game, you can have 25 in the whole rink area. That's your 5-on-5 plus goalies plus officials, and then anybody whose subs are on the sidelines. I'm just noticing we may have lost the sharing because I'm seeing the camera come on to me. So let's switch that back if we can. Next question from Joe Reed Dance. Since this is a municipal order and not provincial, we will not qualify for any of the monies Doug Ford has allocated.
a question about how we pay for all expenses with less children. Really appreciate that question. Highlight that for the provincial government, and we'll be continuing to highlight that discrepancy, acknowledging that that is a challenge. So we are aware of that discrepancy, and we have flagged that for the province already. We will continue to follow up with that.
Yeah, and I know our local leaders have committed to advocating for that as well. Just taking a big picture perspective there. Again, appreciate the question, Joe. This is really trying to avoid a situation where your programs are completely shut down, which I think probably would have more of an impact. Or you have a case and you're getting sued because, or we all are getting sued because we didn't take measures when we knew there were safety risks. Again, a much bigger risk to the sustainability of our programs. Next question, CM. So I wonder if I put this question in. Hello, with respect to the term league, when it comes to playing other teams, the Ontario Volleyball Association is the governing body for Ontario Volleyball. The province is split into regions. London is part of Region 3. Can a London team scrimmage against a Stratford team? From what I understand, the province, the OREG 364/20 prevents play between communities, but I actually don't know how they've defined communities in terms of league play. Alex, do you know that offhand? We're going to take a look at that and see if we can get back to you.
And I think to be very clear, even on that detail, whether or not it's split within London, Middlesex, or across the region, there can't be more than 50 people part of whatever that's split into. So looking at the Ontario Volleyball Association, if the Region 3, Chatham, London, Windsor, Stratford, Hamilton, Brantford area is only 50 people, which I doubt it is. So again, I think the major thing is the 50-person limit, not necessarily the region.
Thanks, Alex. That's helpful. The next question is from Philip McKee. Would the parameters change if athletes were required to wear a mask even during exercise? If your athletes can wear a mask during exercise, the calculation would be different. We're working on the assumption that that's difficult, and the research that we have, including recommendations from the World Health Organization, are that masks during aerobic or heavy breathing exercise are not effective. What happens is they fill up with water droplets very quickly from what you're breathing out because you are heavy breathing, and then they're no longer as effective as a mask, and they're also no longer as effective. It becomes potentially difficult to breathe with them. So theoretically, if we had a magic mask that could do that, it would be an improvement, but that doesn't seem to be the reality. I want to actually circle back because there was a question on a related issue around the CCM Game On masks from Pauline McCallum. I missed that part of your question earlier. Apologies, Pauline. Essentially, we haven't seen data that suggests that those face shields are particularly effective relative to masks. They may make a bit of a difference, but again, air can flow around the shields and potentially reduce their effectiveness. It's also not necessarily a cost-effective solution, would become a barrier for many players, but not to discourage it at all. If you're able to do that as well, you're probably taking safety up to another level.
Next question is from Abby with Whitecaps London Soccer Club. Are you aware of arrangements made between Canada Soccer and Ontario Soccer with regards to protocols of return to play? They have approved contact with provincial guidance. We are in bubbles, etc. Why are you not taking the lead of the province? So a few things. One is when many of the guidelines for return to play were put in place, that was during the summer when prevalence of COVID-19 was exceptionally low, very low indeed. And so again, all of those protocols would have put in place with the acknowledgement that should prevalence increase, different regions would have to respond differently. They were also put in place with the understanding that as evidence of outbreak and evidence of higher risk transmission is gathered over time, which has happened here in Ontario, given what we see with Spinco, hockey in other regions. We've had some basketball associated cases. These are instances that would result in a change to those types of protocols. The other thing to know is that with respect to these professional organizations, they provide very, very helpful guidance. But when it comes to public health oversight, that is through the chief MOH at the provincial level and the respective medical officers of health within the associated health units and those jurisdictions. So we are aware, and this is very in keeping. Again, when you look at those return to plays guidelines, they're completely out the window in Toronto and in Ottawa and in Peel and in York as a result of increasing prevalence. So in many ways, we are certainly in line with the province in recognizing that as prevalence goes up, certain actions need to be taken, and that's what you're seeing here as well.
Next question is from John Kudelka, Junction Climbing Center. Is there any flexibility or possibility for sports like ours that have a mask always on policy? We don't have the cardio efforts of other sports. What about bowling, billiards, archery, curling? Yeah, I mean, the other difference with these sports is you're not talking about large team activities here. So if you're wearing a mask and you're involved in individual sports, then, you know, we're not talking about the sort of 12-person class limits. If you are doing a climbing class and you have a dozen people that are, you know, together for that class, then these limits would apply. But I don't think that's generally how the Junction Climbing Center works. And from what I understand, you folks aren't doing the group activities like birthdays that have happened in the past. So I actually don't think there's a huge impact here to your business. The stage 3 regs would still apply, John, to climbing, where you've got to keep 2 meters from those other participants. But given your space, I think that's something you're complying with probably already. Thanks for the question.
Next question's from Rachel with the Western Fair Sports Center. Can you clarify if the 25 total for an ice pad has to be split into 2 groups of 12, or it can be 1 group of 25 on the ice as long as they follow the rules? Yeah, thanks for the clarification. So in that instance, there would be 25 total on the ice pad, and it would have to be split into the 2 groups of 12 plus however many instructors you can fit to keep within 25 to each side. So again, at any point in time, there can only be 12 on the field of play. And that would refer to the ice pad. Sorry, there can only be 25, 25 on the field of play on the assumption that they're divided into 12. If all of those 12 are going to be interacting, then you can only have 12 on the ice. If you're going to have 12 interacting, they have to be, yeah, so hopefully that clarifies. 25 on the ice, split into 12. If you're going to have the full ice pad being used, then it's only 12 if they're crossing multiple parts of the ice pad. Chris, your
next question I think is related. Lori, we run the small adult softball league at BMO. Are we still good to play? Masks are worn into the facility. Playing areas divided into 3 sections, 25 players per section. So it's basically the same answer that Alex gave. I'm not entirely sure what a section means in this situation. If you're talking about, you know, a section being a full soccer pitch with a divider between that pitch and the next pitch, and you're 25 in that section, and you're, you know, 2 groups of 12 you can keep separated by 3 meters, then you're good. If you have 25 players all in the same space, then you're not aligned with the. Sorry, Alex, do you want to jump in here?
Yeah. So the key thing in all this, and Lori, I actually think you're good to go. BMO has, to our understanding, distinct dividers between the different sections. Within that section, you would have a max of 25 with a max of 25 in that field of play. We would consider one of those 3 sections as a field of play. Participating in the softball game at any point in time would be a max of 12. The 2 teams should be separated. And if I still remember baseball, there should only be 10 on the field at any point in time, 9 on one and 1 on the other. The substitutes, for lack of a better term, would have to be on either side, separated from one another and separated from the cells. But the whole model that we're trying to design here with this order is such that what you are describing can occur. Again, the key thing is that that separation is 25 for that field of play. You're going to have a max of 12 at play at any point in time, and the substitutes are on the sideline, separated from one another and not interacting. Hopefully that's clear. But the whole model here is that these types of events can happen safely. We just need to keep the group sizes smaller, and we need to be able to ensure that physical distance is being kept. And with softball, that's a perfect game in order to try and keep some distance between players.
So thank you for that. And we've got one last question here to take us out to the hour. I noticed there are 321 additional questions we haven't been able to get to. So we will try and pull those and put as much of a question and answer together as we can. I'm just going to make an announcement just now for those who would like to, if you didn't get the invitation to this and you would like to hear what the question and answer has to say, and maybe get a link. I believe we are recording this broadcast, so we can send that to you as well. I will put an email address in the chat box just now. It'll come out as an announcement, and you can send your email to david.rizzuti@mlhu.on.ca to join our mailing list on this, and hopefully we'll be able to answer as many of those additional questions as possible. This question is from Amit Shah. Question related to volleyball. Looking at your new guidelines, a practice run with 10 unmasked players while active on the court and 2 masked coaches would now be allowed. Yes, actually, even 12 unmasked players, Amit. And this would not be impacted by the modified Section 22 orders. Do I understand correctly? Yeah, would now be allowed. That's right. So no issues with having on a volleyball pitch, 6-on-6 play with a couple of coaches. Thank you for the modifications. They are a good step forward in balancing risk and allowing sport. Appreciate your comments very much, Hammett. And hopefully that's a good note to end on. Thank you very much to Dr. Alex, to Dan Flaherty, a comms manager, to Lori, Angela, and Alex Timmel, who were all in the background here, making sure that things flowed smoothly today. I'm publishing that email address just now, david.rizzuti@mlhu.on.ca, so that if you want to get the follow-up with the question and answers, that will be available. Once again, thanks very much, folks. Appreciate your time and energy and everything that's been submitted over the past couple of days. Have a great weekend, and hopefully we'll be in touch soon.